Hi there, everyone. Today, I want to talk about chronic pain some more. I talked about it in a previous video, and I want to talk about it from a slightly different perspective. I talked about it being incorrectly diagnosed and incorrectly treated, but I also want to talk about how people end up having chronic pain that gets into the nervous system, that really disrupts the whole physiology and the neurological functioning of the body. And this can be anyway, let's start here. When when you have pain and it's not treated correctly and the pain persists, you keep getting different kinds of treatments, or they try and keep doing the same kinds of things over and over again. When you have a pain condition, the typical way of treating the pain is with the expectation that it heals in a certain amount of time, and there's a progression. When that doesn't happen, they don't, a lot of times there's not a shift in, okay, well, what's really the problem? They're still treating the part of the body that's hurting, but they're not treating it effectively and adequately to make changes to make you feel better and feel like you're getting the results that you want. Instead, they keep pushing, other therapies, other procedures, ultimately to surgery or lots of drugs and stuff like that. And so what happens is that what happens inside of you, how do you feel about not getting better? What's going on? I can't, I don't experience that kind of pain. I haven't experienced that kind of pain, but I've had clients that have, and I have a great deal of sympathy and empathy for them because I see them going through all sorts of horrible changes in themselves because they doubt themselves. They doubt, the doctors. They, can't trust the physical therapist. They're not getting what they need in order to heal. And so what do you do with pain that's 10 out of 10 or 20 out of 10? And, you go a little bit nutsy and crazy, and just, it's more than disappointment. It's anger, it's fear, it's frustration. There are so many emotions that go on, and you keep hitting a wall where you're not getting the results and nobody's telling you what you need to do to get it better. So there are a lot of pain theories, and they're all brilliant and they're all wonderful. And the thing that happens with those is that they talk about the perception of pain. They don't, they're not taking the situation from where it's starting. Because when you start having physical pain, you're not having chronic pain. That occurs over time. And it occurs over time because you're not getting the results you need and want, and you're not getting the answers you need and want to help keep everything under control. When you have a chronic pain situation that's not getting better, that's not being treated adequately, what is going to go on in your body? The body goes through all sorts of changes. Your mind kicks in and says, well, it's not getting better, and what am I going to do? And you get a little crazy and nuts, and the neurological system impacts what's going on. And so you end up having a neurological shifts where you're overloading the system, and you keep loading the system, in that looping situation where it intensifies the pain. That's how you get that nasty chronic pain that isn't resolved by drugs, by therapy, by, I mean, sometimes, you have behavioral therapies that help, but it doesn't help everybody. And really that is an attempt to control it and manage it, but it isn't a way of healing the chronic pain. And if you want to heal the chronic pain, you have to look at it from a different perspective. So you're in this situation where you're going through you're seeing all these doctors and you're seeing these therapists and you're doing all this stuff. You're doing procedures and you're doing drugs and you're doing therapy, and, and nothing's happening and nothing's happening and nothing's happening and nothing's happening. And you have to look at the pain from a different perspective. The pain, if it's physical pain, if it's from injury, old injuries or whatever, then you have to look at your injury history, your trauma history, what kind of scar tissue you have in your body, because what's not visible doesn't mean that it's not there. You have a surgical scar from a hysterectomy or a C-section, and you end up with pain going down your leg or into your shoulder, and you have no idea where it's coming from. And if you don't deal with the scar tissue that's pulling, actually literally pulling, even though it's a subtle pull, it's going to pull and cause pain eventually or not. I mean, it depends on you as an individual, and it depends on your body as an individual body, but it goes wherever it goes. And it's essential that whoever you're working with is able to see that, feel it, sense it, and be able to unravel that in a way that's kind and compassionate and gentle, because your body's traumatized. And if you traumatize it more, it just continues to function in the fight, fight or flight, or freeze mode, and we can't allow that to happen if we're going to help you heal. Because if you're in a freeze, fight or flight mode, or freeze mode, you're not able to heal. We have to get you out of that state of being and make you feel more comfortable and help you feel like you're going to get better, even if it takes time, by approaching the problem from a very different perspective. And my fundamental thing about treating chronic pain is that we have to look at it as a whole body problem. It's a whole body issue. Wherever you hurt yourself, it's going to impact everything in your body. And where it hurts isn't necessarily where the problem starts from. We can't treat the symptom. We have to treat the root cause. We have to get to the root and be able to treat that in a way that's gentle and supportive of the individual. We cannot continue to traumatize you and your body. We have to acknowledge it, recognize it, see it, and hear it, and treat it as it needs to be treated in order to help it heal, help you heal. And in that process of treating the chronic pain in a compassionate, holistic manner, you get to simmer everything down, and you can shift how you react and how you respond and how your body responds. Once your body says, oh, this is helping me, I can relax a little bit more. And when you can relax a little bit more, we can move a little bit further in and further in and further in. But we're not good. We can't treat it the way that everybody else is treating it. We have to use techniques that address this tissue that's holding your body in the posture that it's holding you in, that keeps you hurting. We have to treat the root cause. And the only way to find the root cause is going through the history, of trauma and injury and scar tissue and surgery, blah, blah, blah. Emotional traumas, psychological traumas, physical traumas, all of those traumas impact how your body is going to function. There are many causes of chronic pain, and I'm talking about a very specific range of chronic pain. I'm not talking about pain from cancer. I'm not talking about pain from organ or system issues, because that's a whole nother animal. We can work with that on some levels, but that's another bull wax. What I'm talking about, musculoskeletal issues that come from old injuries and traumas that you don't necessarily even recognize that they're coming from old traumas. I've seen people that, like, I ask them what they've done, what kind of injuries and traumas they have. And they say, oh, I don't remember, I haven't had anything major. And then they come back, and, a couple of weeks later and say, well, I actually rolled the car over and broke my shoulder or broke something. And, and they completely forget. And it happens all the time. It's a natural thing to forget about the injuries that we've had, because we're living our life. And we're living our life in a way that doesn't really give the space to say, well, I've got this injury and it's going to impact me for the rest of my life. You're not going to think about that. You're not going to go there. You're going to go say, I'm better. I'm well. I'm going to do whatever it is that I need to do. And you're going to do that until your body can no longer compensate. It reaches a threshold. It reaches its limit of compensation. And then you start hurting. When we get old, when we think we're getting old, when we start having aches and pains in our 30s and 40s, and those happen from our old injuries, something starts aching, and, it's a little quiet kind of a thing. And over time, you keep pushing it, or you stop doing the activity that you love to do because you think you're getting old and you can't do it anymore. And actually, the fascial tissue is saying, stop, wait, we've got to undo this. We've reached a limit of compensation. And if we can let go of if we can unravel the compensation, then you can keep doing you can keep doing what you love to do. But you have to unravel that. You have to reduce the strain patterns in your body and open your body up fascially so that it can work. And so what does that mean, to open up your body fascially? We have to understand what the fascial tissue and the fascial system is. The fascial tissue Everything in your body is embedded in fascial tissue. It goes into your muscle cells. It goes into the bones. It's the scaffolding that holds your body and your posture. The way I look at it is your bones give your body structure. Your bones, your skeletal is, that's it. And your muscles contract and stretch and they move the bones. But the fascial tissue holds you in your postural state. When you have traumas, it compensates to help you function as best and as efficiently as possible. When you add one injury over another over time, it creates a strain pattern that at some point comes to a place where it can no longer compensate in the same way, and you start hurting, you start aching, you start being tight, you start being restricted. You may have more injuries and whatever. But it's your body is telling you, and you're not listening to your body and saying, okay, what do I need to do to undo this? Stretching and strengthening muscles and, are not going to make it work. You may feel better for a while, but it's really not addressing the core issue, which is a fascial restriction. And when you have a fascial restriction, whether it's scar tissue or just, pulling from some old injury inside your body, which is going to have scar tissue, you gotta loosen that up, open it up, and stretch it out. But you can't stretch it the way you stretch muscle because it doesn't work that way. The fascial tissue is this network that connects from your head to toe, and in a continuous web, and it goes everywhere. It goes everywhere in your body. Like in acupuncture, we have meridians. And the meridians go everywhere. They connect everything to everything else. And the fascial tissue goes everywhere and connects everything to everything else. From head to toe. From head to toe, it connects everything. And so when you have an injury in one place, it has an impact on other places in your body. And unless you treat an injury as a whole body injury, there's going to be some kind of compensation that you're going to have to deal with later on down the road. You're going to have to deal with it in a way that says, okay, we have to look at this differently. We have to connect your head to your foot and say, this is connected. When you have foot problems, it's usually not a foot problem. It's usually a problem that's someplace else in your body. It could be your low back, it could be your neck, it could be your shoulder, it could be anything. But we have to look at the whole body and see, where is this pull coming from? When we start looking at the body from that perspective, things start healing better and you get results that last. But if you don't, and you just treat the symptom where it hurts, it's the tip of the iceberg. There's so much underneath the tip of the iceberg that we have to get to in order to help you get well, in order to help you heal chronic pain. So you've got this chronic pain that's caused by whatever. You have to look at everything that's going on. So there, did I say everything that I need to say? I don't know. We'll approach it again another way. So chronic pain, let's go back. What I wanted to do was talk about chronic pain as as it develops over time. So if you have a pain that's not being addressed correctly, that you're not getting well over time, and they're doing the same thing over and over again and getting more invasive and more, crazy with the procedures and everything else, you have to start looking at you have to look at the history of injury, trauma, and scar tissue in your body. You have to look at, like the emotional stuff that's going on. But first and most importantly is looking at the scar tissue and the injuries and the traumas that you've had, the physical stuff that you've had. And so that you can start unraveling that. When you start unraveling that, it has an impact on every other aspect of who you are and what you are and how you function and live your life in this world. And if you're willing to go exploring in this place, you're going to be able to get out of the pain. Sometimes that doesn't happen, and sometimes it does. So if you can stop, you can put a halt to the chronic pain when you start looking at it and saying, I'm going to take control of this situation. This is not being treated correctly, and I want to see something different. I want to do this differently because this is not working. You can take drugs. Taking drugs is really easy. It's really convenient, and it covers over the issue. It's a great symptom relief. It's a great pain management tool. But if you want something more than pain management and you don't want to be on drugs, then you have to do something different. Pain management is one element, and that's what a lot of people say. And the reason why they have pain management is because they don't know how to cure the problem. They don't know how to address the problem correctly. They keep, throwing the same damn stuff at it and expecting something different to happen. And if it works, great. If it doesn't, well, you're SOL. And so if you're SOL, then you're on your own. And you can, all of these emotional things, these neurological problems arise, and you're stuck in a rock, between a rock and another hard place. And so what do you need to do? You need to stop that before you get to that place. You need, say, hey, what's been going on in my life? What have I experienced? What car accidents have I had? What traumas have I had? Have I fallen on my head? Have I fallen on my tailbone? Did I break this bone? I've got I've had a bunch of clients in the last year who have broken their clavicle. It goes up here. And the thing is that when you break your clavicle, it has an impact on everything in your body. It has an impact on how you breathe. And, eventually, like say, oh, I've healed it, I'm fine, blah, blah, blah. And all of a sudden something's happening, you're hurting and you're not getting better. And what happens is it always comes back to that broken clavicle and the scar tissue that happens that attaches to the rib cage. It impacts your breathing. It impacts how you move your arm, your shoulder, and everything else. And it can pull all the way down into your leg and your hip and your feet. Because that's what I've seen. I've seen it over and over and over and over again. I'll tell you something. I had a client that used to fall all the time. And when we started dealing with the shoulder problem, she had a horse fell on her when she was 12. And so she had this, she didn't break her clavicle, but she really messed up her shoulder and hurt herself. And when we started clearing that out, she stopped falling, she stopped tripping, she stopped having accidents because she could function and move more clearly. She could walk better because we fixed her shoulder. So there's all these things that happen with injuries and scar tissue, and we have to look at it very differently than what we do than what happens in mainstream. Conventional medicine looks at symptoms, it treats symptoms, it doesn't treat the whole body. It never looks at the whole body. Everything is always disconnected. A foot problem is a foot problem. It doesn't relate to anything else in your body. And if you don't do it just the foot, then we can't see you. Every issue is a whole body situation, and it's a whole body issue. And when we look at the whole body, you get better results faster. And the sooner you start looking at the body that way, the sooner you're going to feel better and the sooner you're going to heal. And so if you've got chronic pain and you're going down that slippery slope into a misery, a lifetime of problems, with chronic pain and not being able to function, then it's time maybe for you to say, let's look at this from a different perspective. You can call me, you can connect with me. I'd be more than happy to chat with you. Just connect with me on, from my website. And I look forward to hearing from you. And if you've got any comments or thoughts or questions, please contact me. Have a great rest of the day, and bye for now.